2 weeks ago, Kansas City Mayor Quinton Lucas announced a new task force aimed at coordinating the vaccine rollout in the metro with the goal of helping people figure out when and where they would be able to get the vaccine.
We're saying that this is a step for us in making a difference.
So is the task force making a difference, and what are the next steps to help people who are still trying to get the vaccine? I-Team reporter Kat Reed is going in depth to find out what the task force has been up to.
We want to be able to come back to you in the weeks ahead of saying, this is where vaccinations can be done, this is who you call.
That was Mayor Quinton Lucas earlier this month, announcing a new vaccine task force. Its members include leaders from major health systems like Truman Medical Centers and Swope Health Services, plus an engineer from Burns and McDonnell to handle logistics. We caught up with task force member Dr. Rex Archer of the Kansas City Health Department. He shed light on what the task force is working on.
Pulling minds together and working as a team can almost always improve your processes. Sometimes teamwork takes a little while if you haven't really worked with those individuals before to kind of get to know each other, but pretty soon it starts to pick up.
Dr. Archer says just having all of these leaders sitting around the same table is already making a difference because there's more communication between agencies.
If somebody's running short and somebody else has vaccine, we can move that seamlessly behind the scenes.
Another short-term step is the sharing of data, especially when it comes to populations at risk for severe cases of COVID-19.
We're the ones that have better, I think, data and analysis of where are our people of color, what languages do they speak, what's their primary language, how do you reach them, and we're feeding some of that into the hospitals right now, so that when they vaccinate, they can also be vaccinating those folks.
In the long term, the task force is looking at sites for vaccination clinics that would be run by Spanish-speaking staff and volunteers. The city says 145 Latinx Kansas Cityans per 100,000 have lost their lives to COVID. Compare that to 50 white residents' deaths per 100,000. The task force is also looking at ways to streamline the registration process so you don't have to put your name on a ton of lists to get your dose. I'm I-Team reporter Kat Reed, 41 Action News.